Welcome, Laura, to Bangalore, India. Very nice to have you.
Thank you, Pramod, to calling me. Is a great honor to be here.
Yeah. No, it is a long time. I always wanted you to come. And I mean, every time you guys come, I learn a lot of new things. More than learning, it feels very cordial about discussing things which are very deep in a child's sarcoma care or orthopedic oncology care. Briefly, Laura, can you just tell how did you end up as an orthopedic oncosurgeon? Yeah, I'm sure, Laura, you are known amongst orthopedic oncosurgeons across the world, but for the general public and for other doctors, if you could briefly tell us.
Well, first of all, I was lucky because my father was the first one to study musculoskeletal oncology in Italy. And so when I was during my medical school, I had the opportunity to join him when I was 3 or 4 years of medical school, to join him in surgery and outpatient clinic, and to meet the most famous and good doctors around the world in this field. So I was very lucky for that. And actually, at the beginning, I wanted to be a pathologist, but I wanted to be a pathologist on musculoskeletal tumors, not on other type of tumors. And because I was not sure to do that, and because I also was fascinating about surgery in this rare field, I decided to do orthopedic surgery, and I chose musculoskeletal oncology because I was fascinating to do something so rare that the other general orthopedic surgeons didn't understand about that X-ray, and I could understand in 5 minutes the problem of the patient. I was very fascinated to do something so rare and so particular, and I was lucky because my father could teach me so many things.
So I can teach my son.
Yes, you must.
You should?
Yeah. if you will do medicine, yes.
Yeah. No, that's the same thing. I think how easily you could pick up the diagnosis is very important, right?
Oh, yes.
Yes. Just before this meeting, I discussed with Professor Dr. Manfrini that early diagnosis when your father, Mario Campanacci, right?
Yeah.
So he proposed a painful knee joint for more than few days, get an X-ray.
Yeah.
So I was just proposing, we have MRI machines every road. So can we put a basic screening MRI for every child with
Too much.
with pain for about 10 days or 12 days, because it's pretty inexpensive, no radiation.
Yeah, perhaps yes. Not few days, but I think that if a child has a pain not related to any trauma for more than 2 weeks, you should do an exam because it's not normal.
Yeah, maybe as you said, you should get the research thing there. Yeah, and with regards to the, I know that you're running a foundation. I mean, in your father's name, right?
Yeah.
So we know the problems of sarcoma care. So as I was discussing, this is a 1 year treatment average if it is osteosarcoma or even sarcoma.
Yeah.
So the problems of a child, school, child health, sibling health, sibling
Yes.
education, parent, spouse, work, travel,
Other children.
other children, finances,
Yes.
and the stigma of cancer. And the stigma of being a bone cancer means death. So these are all the fight a family should have it. I'm sure Italy has done a fantastic job in at least funding the national whole scheme. But beyond that, as you are fighting out for the research, and also I'm sure I know that you're organizing some apartments for the
Yes.
families who come. Yeah.
Our patients come for 90% of them come from outside of Bologna and also outside of my region. So they come from far away. and some come also from outside Italy. We have patients from Serbia, from the Eastern Europe, and so to afford the cure, which is so long, can be 1 year, can be very difficult. They don't know where to sleep. And so we founded this association called Mario Campanacci for my father, in name of my father, with which we have three main missions. One is to help patients and their families during the period of treatment. We have two apartments, and we give 1,500 nights sleeping in a year, and then we help them for the normal stuff you need during the day, the care, and during during their chemotherapy, perhaps we pay for games or that stuff, and also we pay for the transports for the airport, or to go for radiation therapy transfer to other hospitals, and that's one mission. And then the other mission is research. We give some money to the research labs we have at the Rizzoli Institute. And the third is dissemination. So we pay for the course. We do every year a course on musculoskeletal pathology, and also for other type of dissemination. So those are the three main things, and I think those are really, really important. But they're not enough. We also pay for the psycho-oncology, because anything we see that could be helpful for the patients and family care during the treatment or whatever related to them, and we see that we cannot obtain from the hospital or institutions, so then we try to offer. So, for example, we pay the psycho-oncologist since some years, because we cannot have it. We pay for the data manager, because we were able, after a very long bureaucratic battle, to have a registry on the children operated for bone sarcoma. And this wants to be a multicentric registry, Italian registry. And to do that, of course, we need a data manager. So the Mario Campanacci Association is paying for that, because at the moment we don't have any other way to pay for it. And so, speaking of this, I wanted to bring to your attention, and I'm sure you think the same way as I think, that we should need help from the institutions, from the government, from the hospital, because everything is too tough. We want to make research, but it's very, very difficult to find money for publishing a paper, to have a data manager, etc., etc. What do you think about that?
Absolutely. As I always think, there are 1,000 obstructions they create when you do one thing. I mean, for example, when we started the sarcoma care, it is sad to say that many of the organizations, the top organizations in the country, don't even know what is sarcoma. Don't even know what is sarcoma, which is very sad. The top political clan does not know. We did not know what are the types of sarcomas. At least they should know that these are children which can be curable, the funds can be mobilized from many different leaks, which is there. So similar problems in most of the Indian scenarios, most of the doctors, particularly in oncology sector and pediatric oncology sector, particularly.
Because perhaps my feeling is that when something is rare, then on some levels they don't feel it is important, and so they don't think it's that, how do you say, to spend money for to invest
I always say, you're from a land of Ferrari. I always say our work is like Ferrari, because Ferrari, they invest to make one car, and they go bankrupt, and the Fiat saved them, right?
Yeah.
The Fiat, that's the story I know. The Fiat saved them to sell different parts of Ferrari to different companies as a component. Like our orthopedic oncology has reconstruction, removal of tumor, vascular work, chemotherapy work, psycho-oncology, 3D printing, AI, data. So you have every part of your work. Probably we are the Ferraris. That's why we cannot be very.
Yeah, they should. Help
Nobody
us.
funds us. Yeah. So essentially, as you said, that's why most of our young doctors or trainees, even when we do this Indo-Italian sarcoma consensus, right now what GHA is organizing, in this also there are not many people who are like, yes, let's do something about, let's attend this meeting. They say no.
You know what? I have some young doctors working with me, and in the last 2 years I had 3 very, very, very good young doctors, ladies, and they told me, I'm not sure I want to do orthopedic oncology in my future life of doctor, but I want to stay with you and learn with you during my residency, because if I learn from you, I see almost everything. I see the most specialized, the most specialities, and for example, 3D printing, custom prosthesis. So if you learn in this field, then you can manage almost anything. Anything.
Exactly.
Yeah.
There was I remember one application from a young doctor. He came and he said, I am not very strong man to do the orthopedic oncology. I said, you come and attend 2 surgeries with us. We will make you hold the femoral artery in your hand, and you get all the guts out of it. When you puncture, the femoral artery gets cut. So this is the young in Italy. As your residents, yours is one of the largest unit of orthopedic oncology and oldest unit of orthopedic oncology in the world.
Yeah. Well, in the world, I don't know, but we are.
Yeah, I've done my maths, and I've done my thoughts about many centers in the world. I think one is Argentina, Italian hospital, Musculoskeletal. So, and maybe in China, which we do not know what they do generally, because we don't know. But apart from that, such big units I have not seen anywhere. So, how are the newer doctors entering, staying, continuing? What is the percentage? Are they continuing? When they enter, they continue, they pursue? Like Dr. Bianchi is there. Dr.
Well, usually in my group, at least, if you like this field, you try to follow the group during your residency or even before, during your medical school. When you during medical school, you think you would like to be an orthopedic surgeon, and then you come to the Rizzoli and you see some different departments, and you say, I would like to stay with orthopedic oncology. And then if you like the field, you ask to remain during residency. And then you must be lucky also for the historical moment. I mean, we are that number, and if you finish your residency, that nobody is going to change hospital. There is no place for you, and perhaps you don't want to wait 5 years without a payment. So it depends also for that aspect. But usually anybody of my group decided that wanted to be part of the group during the residency, and so everybody was born in the group. We don't have anybody coming from outside.
Yeah. So even in Italy, there is no orthopedic oncology end program by the board.
Not officially, no.
Not officially.
We are in my hospital. We have 3 university departments, and one of them is my department. So my chief is professor, university professor. But for example, I'm not university. In Italy we have doctors paid both by the hospital and by university, and doctors paid only by the hospital. I'm hospital, but I work in a university department. So the mentality, the way of acting of the group is university.
Yeah. I have this strange idea of the same problem. I learned some lessons from Singapore hand department. They, after the MBBS, medical MBBS, they have a direct hand surgery specialty. People who like hand surgery, they need not do surgery, they need not do orthopedics.
They stop and they do only hand.
Hand. So I was proposing, like, we have now the state accredited Rajiv Gandhi University accredited fellowship program, which is one of the only state with accredited fellowships by the state university. We took a lot of difficult problems because there is no examiner to do those exams apart from me. So initially there was an issue. Of course, it is an issue now also. Why don't we, as an international collaboration, may not be in the financial angle which governments or anything, have a degree or some kind of accreditation? Okay, these people, these are the two centers they should rotate in 6 months and 6 months, and we give a degree. So they are the world orthopedic oncosurgeons, because we know it has to be world play, as in not because it's a rare disease. World as one. In our saying, there is in Sanskrit, we have a saying called Vasudhaiva Kutumbakam, means the whole world is one. World is one. That is our philosophy. So as in, I had this strange proposal. Apart from the bureaucratic problems, let's keep it aside. Do you think it is a doable venture?
Oh yeah. You mean this collaboration? Would be very, very nice. Yeah. I think that in our field would be great to, and sometimes we did, sometimes we do. We collaborate for some things. It would be great to create a net of very, very highly specialized center, and then you know, if a young doctor asks where is better to go to study, then you already know that there is a
pathway.
Yeah, pathway.
So I mean, we should not allow them to choose, because if they choose, they will not go.
No, I had the opposite problem. I had these three girls.
Yeah,
they really wanted to go somewhere for a fellowship, but for them it's difficult because they don't have any help from the university, Italian university, so they have to pay. And so
mainly financial.
They have financial problems.
Yeah, so I think that's the reason. I would
like that to have the possibility to offer a based, not highly, but a little bit paid fellowship, so that someone can afford the staying for 6 months or whatever. Otherwise, many doctors would like to do, but then perhaps they don't do for this reason.
Yeah, maybe as if they get selected, what we should do is you have to go to, say, Rizzoli for 6 months. You're paid only if you go there. You're paid only if you go to India, this place. So when then at the end of this you get this degree, it will be from our body, from our probably an ISOLS, if you can ask ISOLS to affiliate, or MSOS or MSOS. Affiliate these 3 countryal bodies. Okay, you are good to go. You have this certificate.
Yeah.
So for them to get a job in the future, it'll be good and they start practicing well. Because as in India, even in the post graduation, you're not paid.
Mm.
Till 27 or 28, 29 years, you're not paid. You don't get money. Most of us, we survive on our parents' money. We have a less of a loan culture, but now it's increasing because the cost is higher. Earlier it is less low. But at 29 years, when you want to get married, when you want to have a family, you have another one to travel, it will be very burden. I understand. I think that is where people stop entering orthopedic oncology. I think if we have to come out with this kind of a program. So this is what I thought. In the future, like as we thought this time, we wanted to have these events by this GHA as an online or offline events, as we discussed as a tumor board or something. Pan through isols or probably through any of these events. Do you recommend we should do for the medical graduates or the postgraduates or the general surgeons? Because this is a constant questions. Who will be the best to start with an online course?
I would say general surgeons, because still I see patients treated by general surgeon with big mistakes. So I think the message to general surgeon and general orthopedic surgeons, general and doctors, family doctors. The message should be if you have the minimum suspect of soft tissue or bone, something. You don't say it's a lipoma or it's a sarcoma. Well, you just said you must know that there are specialized centers and you have to send the patient to that center, and then the specialized center will say it is something benign, malignant, etc. No? Do you have this still in 2025? Do you have still this problem?
A lot of it. That's why we always promote first time right treatment is the way to go.
Yeah. Yes, the prognosis, 60% of the prognosis is what happens at the beginning. And also the opposite. I have patients who don't sleep for 1 month because they tell them that the son has a malignant tumor, and instead the son has a benign non-ossifying fibroma. Because it's true also the opposite.
Yeah, I remember.
So if it's not your job and you see something in the bone or in the soft tissues, don't do all the exams of the world, because sometimes for non-ossifying fibroma they do CT, MRI, bone scan. Just send it to the center, and then the specialized center will do what? No.
Yeah. That's, I think that's why OOP surgery, right?
OOP surgery, yeah.
OOP surgery has come from
still exists.
Yeah, lots of it. I think I think that comes to the policy level which we are pushing. Like in India, my thought is, if any child has pain more than 2 weeks, which is a non-traumatic, get a plain MRI done, subsidized by the government in any MRI center. Then make it as a notifiable disease to the government. Send to a center in the north, east, west, south of India.
Yeah.
From there, I think it should be taken care.
Should be like in England. In England, they have the certified specialized centers. If you are not a certified center and you do a hoops surgery, you get not paid back by the government.
Oh.
And in Italy, we are trying to have this since many years. My chief, Professor Donati, believes a lot in this, and I think he's very right, that they should certify these centers where this type of surgery can be done. And if the patient is treated in another center, then the center gets not any money from the government. In that way, in 6 months, you stop the hoop surgery for sure.
Very true. Very true. No, I think this is your first visit to India, right?
Yeah.
Did you like it so far?
Oh, yes, a lot.
Is it? Okay, thank you. So, why I asked this question was, so India, we all know, a lot of people call it as a spiritual capital of the world. Though it is so, with this question, our children with sarcoma, if I see them 5 years after they finish the treatment, chemotherapy, surgery, everything, I feel they are very, very mature.
Oh, yes.
I feel their IQ is better than anybody of the same age.
Yes.
Do you have anything to say on?
I feel that our patients, they change with the illness. They grow up, them and the family as well. And some of them realize it very well. I have a patient who say he was going to be a professional soccer player. When he was 19, he was diagnosed with a Ewing sarcoma of the hemipelvis. So of course he couldn't play soccer anymore. And he said, that's the best thing that happened to me, because my way of thinking, my personality, my life, everything changed. And today I'm what I am because I had this Ewing sarcoma. He's happy for that.
Yeah. No, I've seen. Now it's 15 years now.
In fact, our patients are special. If I see my colleagues have to operate meniscus or hip prosthesis, we have a completely different type of patients. Our patients are special. We give each other so much, and you create a personal and intimacy
yes.
Relationship with them. So they grow and they give so much to the parents and to the doctor. Usually when the mother cries because of the child, I usually tell her that she cannot imagine how strong, how tough would be the child. Usually the children are much stronger than the parents.
Yeah.
And to go through this illness.
Yeah. Do you recommend them some kind of a spiritual or a religious thoughts in the general perspective? Not very, I always tell them to read something spiritualism. Sometimes I even give books about how life is, how, so that, they feel very, very liberal.
I know what. My father was died for a pancreas tumor.
Oh.
And he wrote, I discovered the day that he passed away. We cleaned up the room where he was in the last days, and I found something he wrote, which was something for himself, not for anybody, where he wrote something very spiritual when he said, at the beginning of my illness, I didn't know why this happened to me, but then I found out that there is a sense of this, and I'm happy for this because, etc., etc. And usually when I see that someone doesn't accept what happened to him or to his son, I get this to read to him.
Yeah.
Because enter in the religion is very dangerous nowadays. so I prefer to...
Yeah, the political religion.
Yeah. No, because you find someone who says, I don't believe, and they close the door. Instead, if I give this to him, it's just to say, see, this can happen to everybody. And you can find spirituality and a sense in it, even if you don't believe in what I believe, but it's not...
That learning is now becoming obsolete amongst the children, I think, but I feel it's coming up with the Instagram Reels and other things now.
Oh, yeah.
I think people are coming with that. I think the kids are realizing, like my son, when I speak to him, sometimes the comments are so mature, I cannot answer. He says, calm down. It's like, oh, calm down. It is one of the spiritual lessons.
Yeah.
Yeah. Any other message you want to give to the public, any parent or a public which have forgotten or anything, particularly the parents who go through a lot, particularly the parents. I have put a board outside my consultation that if you do not understand the disease in your own language, you ask me 1,000 times, I will
Yeah.
answer you. But without understanding, don't even take a tablet from me. Forget surgery, forget chemotherapy. Don't even take a tablet from me, because this is a long journey. It's not a small journey. Minimum 5 years. So 10 years. We are going to live more. So this is how the learnings have to be. This is how I make sure I tell them. If I forget, there's a board outside. So they can start reading it. So you have any thoughts about the parents which they go
Yes,
through a
usually I
lot?
say the same. Usually I say, first of all, you must believe that you will win the battle and the war. When I always make the comparison between you and you or your son to a soldier. When the soldier goes for the war, he goes because he's convinced that he can win. No, usually a soldier doesn't go to the war and say, "Oh, perhaps I will die. Perhaps they will kill me." No, he goes and says, "I want to win," and then he takes all the arms he can. No, bazooka, not only a small knife, takes everything and uses.
Correct, exactly.
And then, of course, not everybody can win the
wow.
battle, but you must believe in, because if you don't believe from the beginning that you can win, it is useless, because then the destiny is, I mean, the it will happen anyway, in the positive or negative, anything you feel will happen. So it's useless, and it makes you feel bad. I think everybody must be positive. I was, when my father was dying, and it was so helpful for me, for him, for my family, because it makes no sense to be negative in this occasion. Then you can be negative at the end. You finish the story, and then you can talk about it afterwards at the end.
Yeah, I think the Plato's the book on meditations, right? No, Marcus Aurelius. So he says, you expect the worst. You think about the worst. What can happen to you? Then you're already free. Anything is a bonus for you. So that's a very nice thinking. He calls it positive negativism.
Yeah.
So that's how you plan it. Essentially, you plan the things. Everything.
Yeah, for me it's the opposite. I say, no, you must be positive, and then if the negative will come, okay.
Yeah.
But if you are negative from the beginning, then you feel worse, no?
Yeah. Preparedness, essentially prepare, plan, and be ready for. Then go for the war.
Yeah.
Thank you, Laura, for this.
Thank you. It was very interesting and instructive.
Yeah, I think it's learning for all of us. I think most of either our parents or even the grown-up patients of ours who will be watching these videos, I think it will be good for all of us to carry forward some of this. Thank you for understanding. Thank you.